So the current studies actually showed that children 6 months up to 2 years showed a robust immune response, but the age of 2 years to 4 years, that immune response was not the same as children that were over 4. And so they're currently looking at a third dose. As far as safety, the safety was looked at, and it was found to be as safe as in children that were 5 and above. But as far as effectiveness, that's where they needed to look a little bit further at that third dose. I hope that we'll be able to get the FDA approval soon after they look at the studies for children under 5 with the third dose that they receive and looking at that immune response to assure that is as equal to those that are 5 and above. So we saw as new variants were coming in, even with the Delta variant, that we saw a increased number of children hospitalized. I had more children in the hospital with COVID, fortunately recovering pretty well. And then as Omicron moved in, we found that more individuals were being affected by Omicron. So it was much more easily spread than some of the other variants. And as we had children that were unvaccinated, that spread was much easier. And that number, 25% of children were being affected by COVID, which was a much higher percentage than in the past. And so with that much higher percentage, we were starting to see much higher numbers in the hospitals for children, even though that's still less than 1%. So for children that are 5 to 11, 10 micrograms is the current dose, which is less than children 12 and above. For children that are below the age of 5, that dosing is 3 micrograms, so significantly less of a dose. And that immune response in the children aged 2 to 4 was not found to be as effective. And so now they're looking at that third dose to look at that effectiveness to assure that they are going to have that same robust immune response as children that are 5 and above. There was no safety concern. There were similar symptoms that they found as far as side effects, the common side effects after you receive a vaccine, just pain in the arm, fever, fatigue. But what they were looking at was more on the effectiveness side and how well you built that immune response from COVID. Currently, looking at that dose that's in comparison for children that's 5 to the age of up to 12, it's about a third of the dose. So it's much less. And so that's when they were looking at how effective that dosing was. It wasn't found to be as effective. And so that's why they're looking at that third dose to assure that it is much more effective in reaching that immune response that's similar to children 5 and above. So when we look at the number of cases of myocarditis, you will see commonly what they estimate 54 cases per million doses received. And so that rate is really low. And if we think about the number of children that have died from COVID, that has been over 1,000 children that have died from COVID, and the number of children that have developed MIS-C, which can be associated with myocarditis, there's over 7,500 children that have had MIS-C and approximately 48 deaths from MIS-C. And so if we compare the two, and we know that the number of associated myocarditis cases are self-resolved with the vaccine versus you can actually get COVID and myocarditis and associated deaths with that, the risk-benefit has shown that you're much more safe getting the vaccine and as opposed to getting COVID and putting yourself at risk or your child at risk for developing myocarditis.